In today's video, we are going to see about a very common disease or a condition called hernia. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, health related content is being discussed via short videos which are released every week. If you want to see such videos, kindly subscribe to this channel. And if you want some content to be discussed, kindly mention in the comments below. I'll try to put it in the subsequent week's video. This week's video is about hernia. What is hernia? Even though this hernia is discussed in the context of abdominal wall hernias, hernia is just a protrusion of content through a defect, which is either congenital or acquired. It may be a defect or a weakness. Okay, so some content is protrudes out through the defect or weakness. It is hernia. Can happen in the anterior abdominal wall, can happen in the diaphragm, diaphragmatic hernias, hiatus hernias. Even the brain content can herniate. Okay, if a content protrudes through a defect or an opening, that is called herniation. Because these are most common in the anterior abdominal wall, we only tend to think about anterior abdominal wall. In anterior abdominal wall, you can have hernias in the above the umbilicus, supra-umbilical hernia. Commonly in childhood, you can have umbilical hernias. So the muscle behind the umbilicus is not closed, so some content protrudes through the umbilical opening. Or you can have ventral hernias even below that, or you can have incisional hernias, a previous surgery like a cesarean section that cut in the muscle led to a weakness of the muscle, through that abdominal contents migrate out. This is called ventral or incisional hernia. Similarly, in the groin region, you can have inguinal hernias or femoral hernias, very commonly known to the public. So, scrotal hernias, they come through the scrotum, so they are called scrotal hernias, but again they come through the anterior abdominal wall. Since the most common hernias are through anterior abdominal wall, the contents usually is the abdominal content or the intestines. It need not be always intestines. It can be the fat surrounding the intestines called omentum. If the herniation is large enough, you can even have other organs like liver coming through that hernia. So usually that's why you have intestine hernia. Okay, what are the symptoms of these hernias? Usually majority of them are asymptomatic to begin with, but more than the symptoms, it is the complications which we fear or worry. What are these complications? Either an incarceration or a strangulation. In incarceration, the bowel comes out through the herniated opening, but it's not able to go back in. It gets caught in that narrow passage, narrow opening. Okay, or strangulation, not only the bowel but also the blood supply to the bowel is also caught. So what happens? It gets necrose. Imagine if these complications develop, you will land up in a surgical emergency. Unless operated immediately, it can even result in death of the individual, loss of bowel or loss of life, death itself. So these severe complications are the reasons why we worry about hernia and insist on the treatment for hernia. Okay, what is the treatment for hernia? Often we hear about I don't prefer this form of treatment, I like to try with this therapy. For some diseases, you don't have choices. Similarly, for hernia, even though you might have heard locally, social media, that this thing helps, binders help, all these are nonsense treatments, might even result in complications. That is, they themselves might result in incarceration or strangulation. So the only effective treatment for any hernia is surgical therapy. Surgical options are available via open surgery or via laparoscopy, but surgery is the only treatment choice available. Why, sir? Even for babies, even for umbilical hernia? Yes, it is so. Even for umbilical hernia, especially if it lasts more than a year, okay, the child is more than 1 year old and the umbilical hernia is still persistent, probably it is wise or prudent to undergo surgical correction of hernia. If surgical correction is not attempted, you might land up in an emergency which can lead to, as I already said, loss of bowel or loss of life. An emergency treatment is always riskier than a planned elective procedure. So for hernia, the elective effective treatment option available is only surgical management. Friends, hopefully you would have understood a little about hernias in general and the importance of the surgical treatment. If you found this video useful, kindly share it among your friends and relatives. If you want to see similar videos, kindly subscribe to this channel. Till we meet again, bye.